We are live. Welcome to the Plastic Surgery Podcast, where we talk about politics. Just kidding. We're talking about everything plastic surgery. I am here with the one and only Dr. Lambros Viennes, who also happens to be my father. Okay, let me think. How am I going to introduce you? How many years did you go to college?
So starting after high school,
Starting after high school, yeah.
so after high school, I went to college 4 years, and then I decided at the time when I was younger to become a dentist. That was my passion. But halfway through dental school, we had an opportunity to work with the oral surgeons at University of Maryland, where I eventually went to dental school. And we wound up rotating through the hospital, and I saw a very interesting oral surgery case, and I thought that that would be my career, that I would love to be an oral surgeon. So I did go into oral surgery, did a
Right.
residency there at Temple University.
Mm-hmm.
And while I was at Temple, we had the opportunity to work with the plastic surgeons there. And in fact, I had the opportunity to go to England and work with some wonderful oral surgeons there who actually did quite a bit of surgery, including plastic surgery. So that's when I decided, when I came back from England, that I wanted to go to medical school.
You went to dental school before oral surgery,
Yes,
correct?
correct.
So it was you you were licensed as a dentist, correct?
Correct.
And then oral surgeon,
Yes,
and then plastic surgeon.
correct.
Okay, so how many years did it take you
Total?
total?
Total, it was from high school on, it was 18 years
18,
after high school.
18 years of university. How many years were you in private practice?
So total 14 years. And the hospital that I was affiliated with at the time, they also had a surgery residency. So I had the chance to work with residents in teaching. We had some students sometimes rotate with us. It was a very busy hospital. So I loved the teaching aspect, and also had an appointment as a plastic surgeon on the part-time faculty at Johns Hopkins. And I worked with a lot of the residents there at the time, and I really loved the aspect of education.
So fast forward, you end your private practice after 14 years, and then you come down to Virginia and you work at a hospital here, and you split time between lecturing and performing surgeries, correct, and seeing patients.
Correct. So I'm a full-time faculty member at the medical school, and I have students and residents that we teach, and I also practice full-time plastic surgery as well. We see a lot of severe types of injuries.
You do both plastic and cosmetic
Yes.
procedures. Okay, so you've obviously had to perform a lot of cases in your tenure. I'll keep it to the most recent month. So just generally speaking, this past month, what was the most interesting case that you had to perform on somebody?
So there are a lot of different types of cases that we perform surgery on. I would say that there's a whole lot of different things that we do, whether it's a large case or a small case and so forth that we do. The probably the most interesting thing I think in plastic surgery is the planning of a case, whether it's a small case or a big case that we do.
So, getting past the planning, like what, just give just like a brief example of like a general case that you've had to perform recently. Of course, without giving away any patient identity, so we don't get any HIPAA violations on this podcast. Just generally speaking, what is the most interesting case that you've had to perform in recent weeks?
So some of the things that one of the types of cases that I really enjoy doing is patients that suffer from burn scar injuries that have very significant contractures and injury to their skin from burns. And so, in order to improve their functional um, aspects of their injury, or to make them to treat their facial or their body deformity, we use different types of techniques to release these scars. And we also use a specialized type of laser that really is pretty amazing, actually. It actually makes the scars softer. It changes the whole morphology of the skin when we do these types of treatments. It may take a few sessions to get to that point, but it really does enhance your treatment. So it's basically, like I mentioned, as a planning stage, you have to kind of plan out what your laser can do for you,
Right.
what your surgery can do for you to ultimately come with a significantly improved outcome.
So basically, these you have patients that come to you that their skin is just scorched by fire. They have lesions, burn lesions. Is
Yes.
that correct? Okay, so they have burn lesions all over their body, and then you have to come in and basically do what? What do you do exactly with the lasers that you use?
So the thing is this: the patients that come in, they have a burn unit there too. So our wonderful burn surgeons actually keep these patients alive if they have
Right.
significant burn injuries, and then they do all the treatments to get the skin to heal.
Like
But
what?
the
Like give an
problem is,
example of.
they'll do like cleaning of the wounds
Mhm.
very, very carefully.
Right.
They may have to do skin grafts and things like that they may have to do to resurface the skin because they want to get a closed wound so it doesn't get infected.
Right.
Of course, if the patient comes in with serious burn injuries, they also have to keep the patient alive, so they have to do a lot of different things.
How can someone die from burn injuries?
Well, the big problem with burn injuries is that it removes, when you have these large burn surface areas that are lost, the skin is lost. Your skin has a lot of functions. It helps prevent infection.
Mhm.
So that's a big problem if you have open wounds. You have a lot of shifts of fluid that occur during a burn injury because the patient's body is now combating a bad injury.
Mhm.
So they could, lose their blood pressure. They could lose blood perfusion to different organs, and they can go into a kidney failure. Or it's like a physiologic response to the burn injury that occurs. And then, of course, the other issues are if they have like an inhalation injury, it could damage their lungs. They may not be able to breathe right, and they have to get support from that. So there are a lot of different components of the burn that our burn surgeons actually have to take care of. So
What's the biggest cause of death from burns? Is it infection?
well, yes,
Okay.
yeah, it could be infection, but again, if it's a lung injury, it could be the lung injury.
Right.
There are different things that could cause it. So and the depth of the burn, and
But how does it affect the lungs though?
well, because as I mentioned earlier, there's a physiologic response that occurs to the burn when it's
Right.
a large burn, that your body senses that there's a big problem, and then you have an inflammatory response that occurs, and your capillaries start leaking a lot of fluid into the tissues. And when they leak in the tissues, then you lose the volume that's inside your circulation system that gives you blood flow to different body parts.
Mhm.
And so then what happens is they have to make sure they maintain the circulation to the patient with various means. But that leakage that occurs, like it can leak into the lungs, and when it leaks into the
Okay.
lungs, it's like having you can't pass oxygen through the lungs into your
Right.
blood
And
vessels.
that's a physiological effect
Right,
from the
exactly,
burns.
from the
It's
burn
just a
injury.
natural
Right,
effect
right.
that your body releases these
Yeah,
fluids.
or it could be a direct injury to the burn,
Right.
to the lung itself,
Mhm.
because that as the hot air goes into the lungs, it could damage a lot of the bronchioles, and it affects the ability for air to be exchanged,
Okay.
oxygen. So if you don't oxygenate, then of course you die from that. After you get everything resurfacing and cleaned up and healed up, the next step then that occurs is a number of things, is the contractures that occur from scars, because scars will form and they can get thick, and they can start causing contractures like to the point where you can't extend your elbow if it's across the top of your elbow, or it may pull your jaw down to your chest. And those are things that you could try to fight with different types of methods like physical therapy and silicone gel that we put on the scars and compression and so forth. But there's just it's very tough to do. So when these things occur, you try to prevent them as much as possible. But when they do occur, and especially if they cause disfiguring injuries, especially to the face and so forth, that's where, as a plastic surgeon, I come in and help them out with doing different types of procedures.
So what are the lasers used for?
Well, the laser, what that does, it does a number of things.
Is it just one? It's one type of laser
It's
that's
a couple
used?
different types
Okay.
that we use, but the one, for example, that I use, it actually creates little micropores in the scar tissue, and that somehow affects the formation of new scar. It sounds like it's counterintuitive that why would you burn scar when
To
you've already
create
come to
scars,
burn, right?
yeah.
But it gives you a better orientation of scar tissue. That's what theoretically occurs, and so new scar forms. But then you can like treat that again with the different forms that we talked about earlier. Now, that's not the only thing we do. There are a lot of other things we do too. Sometimes you have to do steroid injections to break up the scar
Right.
tissue. Sometimes we have to do releases. Sometimes we have to do skin flaps. Sometimes we have to do skin grafts. There are different things that we have to do to kind of separate that tissue so that we can get it kind of back to where it belongs.
Mm-hmm. But the lasers in particular that you use are just to break up the scar tissue that has formed after the skin has basically healed over the burns.
Right, exactly.
And you have to break that up. Explain why you have to break up that scar tissue. You talked about immobility. Forming the scar tissue causes immobility on different limbs, but I mean, does it get more severe than that?
So what happens is a scar, when it forms, it starts forming after about 3 or 4 weeks in any kind of, whether it's surgery or cut or whatever. And then after 3 weeks, it goes through a remodeling phase where it should get softer over time. And that may take a year to a year and a half, maybe longer sometimes. But during that time period, you do different types of things. You do physical therapy, you do the compression, as I mentioned earlier. We have silicone. We do different types of things to kind of, stretch out that scar so it doesn't like pull the joints back together again or cause disfigurement. But sometimes it's inevitable that even doing all that may not help you out, and that's where the surgery and the steroids and the laser as a combination treatment helps out with the improvement that you can obtain. You're not going to get 100% improvement, but it'll significantly help a patient out.
Right. So it's basically to break up the scar tissue and form new scar tissue, if you will.
With the laser, yeah.
Yeah. Mm-hmm. And then the other treatments are just to basically break up the scar tissue to prevent disfigurement. That's right. That's the main problem with scar tissue, correct? Is it creates disfigurement.
Yes.
Throughout the joints. So it
could be if it's across a joint, it could potentially create the joint to contract to the point where it doesn't extend anymore. Let's say, for example, or it could pull your neck down if it's across your neck, or it can pull your lip down if it's down along the lower lip, or your eyelid. You can pull down your eyelid just because it just kind of pulls itself together and it crunches it down.
So burn injuries in particular are probably the most interesting cases that you get. Would you say?
I think that it's always a challenge to treat these patients. I find that burn scars interesting is because I think they're probably one of the most challenging types of cases to do, at least from my standpoint.
That's coming from a person who reattaches fingers on hands. I think that was all for the first episode of the Plastic Surgery Podcast. We will be coming to you again next week with more topics. This was purely just to introduce my father, Dr. Lambros Viennes. For those of you who don't know, I am his son, Philemon Viennes. I have no background in surgery whatsoever. Absolutely none. I know probably less than you do about plastic surgery. So I'm here with you, and I'm going to try to get him to answer questions that really explain these topics thoroughly. We'll come back to you next week with more topics. Thank you guys for watching.